quite important daw kasi it's a proof that
This call is now being recorded.
okay, that we are actually lecturing. Okay, so let's continue. Ayan. So when we talk about fluid volume deficit, this is the loss of your extracellular fluid that as of now doesn't affect your electrolytes. So ibig sabihin, it's in the same proportion. Okay? So let's continue our discussion. What about the patient with a fluid volume deficit? So as we've said, this is a decrease in your intravascular, interstitial, and or intracellular fluid in the body. Now when we talk about dehydration, we're talking here about the loss of water alone. Okay, so sometimes fluid volume deficit and dehydration are used interchangeably. Okay, now what are the possible causes of a fluid volume deficit? So, ibig sabihin, pag nakita mo to sa pathophysiology mo, ilalagay mo na kagad as part of your nursing diagnosis is fluid volume deficit or the risk for fluid volume deficit. Okay? So, you have their vomiting. Obviously, when you vomit out water, so it can lead to your fluid volume deficit. Diarrhea, sabi natin liquid stools. Okay, so it can again lead to your fluid volume deficit. GI suctioning. So if you do NGT suctioning, you suction out not just the, let's say, if you're suctioning out phlegm, okay, so you're not just suctioning out the phlegm, you are also somehow suctioning out the water. Okay, so sweating or diuresis, Addison's disease. Have you ever heard of Addison's disease before? Narinig na? Addison's disease? Anyone? Hindi pa po ba ito narinig? Pwede, you can answer using chat or emoticons. Have you ever heard of Addison's disease before? So, hindi pa. If, remember earlier on, nabanggit natin that um your horm or rather kung naalala niyo yung RAAS, so kung naalala niyo nabanggit ko sa inyo yung adrenal gland. Okay. So yung adrenal gland mo, yan yung affected if you have Addison's disease. So Addison's disease is usually the atrophy of the adrenal gland. Okay? So yung adrenal gland mo, which is located on top of each kidney, nag-atrophy siya, meaning parang nag-shrink. Okay? So dahil doon, wala ka ngayong aldosterone, wala kang glucocorticoids, wala kang androgens, okay? So wala kang epinephrine nor epinephrine, no? So because of the atrophy of your adrenal glands. So the resulting disease is known as Addison's disease. Ayan. So isang characteristic sign niya is your bronze-colored skin. So I'm gonna discuss that siguro after this. Pero endocrine system kasi ang Addison's disease. Doon siya usually dinidiscuss. So, sa inyong MS ba, meron kayong, nakita nyo ka na kung meron kayong endocrine disorders? Or, kasi ang natapos yung respiratory, tama ba? Respiratory cardiac. Yan, cardiac. Okay. So, probably you're not yet done with this. Okay, then you have your hemorrhage. So, let's say for example, sinaksak ka or binaril ka, ayan. So, you will have now your bleeding. So, that bleeding, okay, a motor vehicle accident, so meron ka mga internal hemorrhage. So, that can lead obviously to your fluid volume deficit. Then you have your third space fluid shifts. So, remember, nabanggit natin that you have what we call as yung extracellular fluid mo, meron din siyang second, parang tinatawag natin na interstitial fluids. Now, yung interstitial, ito yung in-between cells. Tapos, meron kang intravascular. Pero, meron ka ring third space. And this third space fluid shifting is usually found in your cavities. So, dapat yung mga cavities mo, meron lang yung normal amounts of fluids, like your pleura, yung, di ba nabagit natin thoracic cavity yon, then you have your peritoneum, which is your abdominal cavity, then you have your in between cells. Okay, so kapag usually nangyayari yung third space fluid shifting natin, kapag yung fluid na supposed to be nasa loob ng cell or nasa loob ng blood vessel, lumipat ngayon sa mga cavities mo. So just like in cases of edema, 'di ba sabi natin edema is usually the interstitial fluid, nagpunta doon yung fluid, wala siya talaga sa loob ng cell, nandun siya sa in-between cell. So pag minamanas ang isang patient, you can check for edema by pressing Okay? The part that is edematous. Tapos makikita mo, meron siyang pitting edema, ang tawag natin, P-I-T-T-I-N-G, pitting, kapag pinrest mo, tapos nagstay doon yung daliri mo. 'Di ba supposed to be yung skin taut siya, T-A-U-T. Pero kapag pinrest mong ganon, dapat supposed to be, or pininch mo, 'di ba dapat babalik siya? Kasi elastic siya, taut, no? Pero ang nangyayari kapag may edema siya, because of the interstitial fluids shifting, what happens is that if you press it or if you pinch it, yung pagka-pinch mo remains. No? Alam mo yung parang clay? So if you played clay dough before, pag ginan mo, uy, andun yung finger ko. So pitting edema yon. Okay, yun yung tinatawag natin pitting edema. Okay, so that is another cause of your fluid volume deficit. So ascites, di ba alam mo ascites is actually brought about by hypoalbuminemia. Ibig sabihin, decreased albumin in the blood. Bakit ba? Sino ba ang usually nagkakaroon ng ascites? What conditions do you find ascites in? So, hindi pa kayo tapos sa GI, di ba? GI problems. But your ascites is usually associated with liver disease. At nabanggit natin last time that liver is the one that produces your protein. Okay? So, si liver, pag di na niya nagagawa yung function niya, so si protein hindi na po produce. Ano nangyayari kay liver? So, si liver, ang nangyayari sa albumin, bagsak, hypoalbuminemia. So, bumabagsak din po ang oncotic pressure. Pag bumagsak ang oncotic pressure, si fluid na supposed to be nandun sa loob ng blood vessels, lilipat siya sa peritoneum. Pag nasa peritoneum siya, yan, you will feel it. So that's your ascites, no? And then you will see it kasi makikita mo lalaki yung kanyang chan. Okay? So we measure that using your tape measure for your abdominal girth. Okay, so that is your ascites. Now, let's look at the pathophysiology. So, ito nabanggit naman na natin. No? What are the causes? So, baka may additional lang. So, aside from GI suctioning, vomiting, diarrhea, so you have their intestinal drainage, intestinal fistulas. So, sometimes there are conditions wherein, let's say for example, post-op ka ng appendectomy. Ayan. Tinanggal ang appendix mo. Minsan, the doctor will place there a drainage, a Jackson-Pratt drain. So kasi gusto nilang i-drain yung wound. Ibig sabihin tatanggalin yung mga remember kapag lalo na kung ruptured po yan, no? Pag pumutok ang appendix mo, usually yung mga laman ng appendix na yon, the products of inflammation, irritant yon sa peritoneum. No? Kasi syempre hindi yun normally nandun. Pumutok. So ang gagawin ng doctor, i-drain yung wound. So we call that as wound drainage. So sometimes yun ang nag-lead sa dehydration. Okay, fluid volume deficit. Same thing is true with your, kung meron kang mga stoma, like your colostomy, ayan, so, or ileostomy, that can lead to your fluid volume deficit. Then you have their diuretics use. Okay, so if you overuse diuretics, what happens? You will urinate, and that will be a problem. So you will have fluid volume deficit. Any problems with the renal system, you have endocrine disorders, nabanggit natin kanina yung Addison's. So we'll talk more about that. And then you have your SIAD, DI, yung mga yan, pag-usapan din natin. Then the hotness of the environment, syempre you will sweat because that's the defense mechanism of the body in maintaining your temperature. So kapag mainit yung environment, meron tayo kasing mini-maintain na core body temp. So pag masyado na mainit, kailangan mag-heat transfer ka. So ang gagawin ng iyong para ma-maintain mo yung core body temperature mo, so ita-transfer niya yung heat using the process of evaporation. So ita-transfer niya sa sweat molecule, yung sa water molecule, and then yung sweat mo mag-evaporate. So somehow you will be yung heat na yon, yung katawan mo mano-normalize. Na-try niyo for example na halimbawa nag-exercise. 'Di ba? After nyo mag-sweat, you feel good. Kasi parang pag napawisan ka, you feel good kasi bumabalik sa normal body temperature mo yung iyong body temp. Kasi parang na-alleviate yung init. Pero during the exercise, and so when you do your like cardio exercises, it's not more on, how much you do. Let me just get some alcohol. It's not more on how much you do, but it's more on about reaching your peak heart rate. Yan. So, kailangan maabot mo yung peak heart rate mo. And usually, the maximal heart rate for an adult will be 200 minus your age. So, ganyan yung computation natin. No? So, 200 minus your age. So, kung ako, 200 minus 33, that's my maximum heart rate, normal heart rate. So, if I do exercise, kailangan maabot ko yun. Kaya kayo may mga fitness tracker kayo, di ba? I-measure yung heart rate nyo. Okay, so kasi pag reach nyo yung heart rate nyo, so it's a good exercise for your cardio, for your heart. Okay, so other causes will be hemorrhage. So, nabanggit na natin yan kanina. Okay, so, hypovolemia will result, kaya nga fluid volume deficit. So, your medical term for that is hypo, meaning decrease. Volume means, the level or the amount. And then your emia is blood. So, there's decrease in the level of the blood. Okay? So, the third, spacing. So, nabanggit na natin to. So, it can be the shift of fluid out of the vascular space into the unusable space, like your peritoneum, it's unusable, di mo siya magagamit. So, nandun yung fluids mo. Supposed to be wala doon. So, you have triggered by stress hormones. It can be difficult this is difficult to assess. So, it can lead to shock and even multi-organ failure. Why? Because you need to have an appropriate blood pressure, okay, blood volume, para to maintain life. Kasi remember guys, blood is the water in your blood is the one that delivers every nutrients, even yung mga formed elements natin sa dugo like your red blood cells, yan, hindi yan magbabiyahe ng walang plasma, which is the liquid portion of the blood. So, ibig sabihin, kailangan mo yung water to deliver oxygen throughout the body. So, without that, it can lead to your shock and even multi-organ system failure. Okay? So, that is your fluid volume deficit. Now, what will be your manifestation para malaman mo na, ay, ang pasyente ko, meron siyang dehydration. Meron siyang fluid volume deficit. So, you have their weight loss. One of the ways for you to test for or assess for presence of fluid volume deficit is for you to weigh patient daily. In the board exam yan nasagot. Aside from daily monitoring or strict monitoring of intake and output, may mas accurate pa doon, which is your daily weight monitoring. Bakit? Alam natin that 1 kilogram lost is equivalent to 1 liter lost. Ganun yon. So, let's say for example, tapos pag daily weight, okay, pagka monitoring of weight at daily weight siya, no, usually, ay, may mga nag-chat. Yan. So, hindi ko masyadong makita yung mga chat nyo kanina. Okay, so for daily weight monitoring, okay, meron tayong mga same. May mga, what do you call this? Protocols ang hospital. So, you have same scale, same clothes, same time. Okay. So, ito po yung ating daily weight monitoring. So, usually it's done before the patient does anything. So, before eating breakfast. So, sa umaga. So, daily weight monitoring is same time each day. Same clothes, obviously, for the purpose na baka naman yung clothes niya ay 1 kilo. Kaya akala mo, ay may fluid retention. Ayan. Kasi yun pala hindi, yung damit lang niya mabigat. Okay? So, same scale. Kasi iba-iba minsan, although yes, we have to be, dapat lahat ng weighing scale accurate, kinakalibrate, pero may mga times may differences yung weighing scale. So kapag ibang weighing scale naman ang ginamit mo, okay, it can lead to the discrepancy. So pwedeng ma-misinterpret mo siya. That's why, when you do daily weight monitoring, same scale, same time, same clothes. So usually naka-hospital gown. Dapat, ideally, ang pasyente pag minomonitor ang kanyang weight. Okay, so that is rapid weight loss and then pale skin. Nawalan din ng internet si Hernandez. O nga, no? Kaya nga sabi ko, dati pag signal number 3, walang pasok. Ngayon, pag no signal, no classes. Di ba? Kaiba na eh. Naiba. Naiba ang new normal. Okay. Okay. Sige, let's continue. Then you have their decreased skin turgor. Ang skin turgor, nabanggit natin kanina, it's when you pinch the skin and it goes back to normal. Pinch the skin, goes back to normal. That's your skin turgor. It's the elasticity of the skin. So, ibig sabihin, ito yung mga manifestations na to, ito yung mga i-assess mo sa patient mo to verify kung meron talaga siyang fluid volume deficit. So, check mo kung meron ba decreased skin turgor. So, isa pa, syempre, I&O monitoring tayo, urine output. Dapat, usually, kapag may fluid volume deficit, ang pasyente mo may oliguria. Okay, bakit ma'am? Syempre, kapag konti ang dumadaloy sa kanya na fluids, konti lang yung i-urinate niya. Okay? So, because the kidneys filters out the blood. Next is your tachycardia. As a compensatory mechanism, as I've told you yesterday, um, your heart responds to your baroreceptors, and the baroreceptors are usually located in your carotid sinuses, in the aortic arch. Ayan. So, or it can respond to the release of your renin. Ayan. So, yung, at saka yung ANP, no? So, atrial natriuretic yeah. So your yung itong mga factors na to, it's the one that normalizes your heart rate, your blood pressure. Now, kapag ka ikaw ay may mababa no na circulating blood volume, so obviously the renal kidneys or your kidneys are hypoperfused. Kulang yung oxygen na nakakarating sa kidneys. When that happens, so it will lead to a compensatory mechanism which will increase your SNS. Kaya nga po mangyayari vasoconstriction at saka po heart rate is increased. Okay. SSS. Okay. Okay, next is your decreased systolic BP. So yung decreased systolic I feel so adulting. Ito pala ang mga techniques sa inyo guys do. When you increase in age, it doesn't feel like, you know, you're like adult or something. Parang feeling mo pa rin bata ka, ganun. Like, you know, ganun. So, pag nag-work na kayo, yan, may mga adulting mode, yan. Bayad SSS, chika-chika. Okay. So, let's continue. So, decreased systolic blood pressure and decreased venous pressure. So, you know the reason, kasi decreased blood volume. So, pag decreased blood volume, obviously, it goes to show that you will also have hypotension. Okay? Kaya nga, ang signs and symptoms ng shock is actually the signs and symptoms of hypovolemia, hypotension, tachycardia, tachypnea, hypo, tachy. You know, keep that in memory because that is like, you know, basic. Okay, so yun yung mga iniisip mo kapag ka ang pasyente may fluid volume deficit. If you get their vital signs, you will see hypotension, tachycardia, tachypnea. Okay, diagnosis. So how do we diagnose this? So serum electrolytes will be done, okay, by your doctor. Osmolality of the blood, of course. Hemoglobin hematocrit, so mga CBC natin. Urine-specific gravity and osmolality. Nabanggit ko na to sa inyo yesterday about urine-specific gravity. What's the normal value again?
1.10 to 1.025.
Okay. So 1.010 to 1.025 is your normal urine specific gravity. It decreases every time that you have. Kailan siya nade-decrease? Kapag ka ikaw ay dehydrated or fluid excess? Decrease.
Dehydrated.
Oh, actually, marami nalilito dyan. Fluid volume excess, decrease urine specific gravity. Fluid volume deficit, increase urine specific gravity. Okay? Tumataas po. What about electrolytes? What do you think? What happens to the electrolyte concentration when you have fluid volume deficit?
Increase po.
Very good. Increase. Bakit increase? Kasi konti yung solvent. Remember that electrolytes are solute in nature. Ibig sabihin, ganito, I want you to imagine this one. So, technically, if you have fluid volume deficit and it's equivalent lang dun sa inyong serum electrolytes, what happens there is, talagang bumababa yung ibang electrolytes. Like, for example, your sodium, minsan nagde-decrease din siya. However, Kapag pinag-uusapan natin is water alone, like dehydration, like water alone, we're not talking about electrolytes. There's a tendency for your electrolytes to actually increase in amount when you get it. Kasi remember, it's a solute. So anong ibig sabihin no? Let me give you an example of this. Let's say for example, sino dito yung nakatry ng magtimpla ng juice sa yung nagtitimpla ka ng juice sa pitchel, pero before mo ilagay sa pitchel, tinitimpla mo muna sa baso. Meron mang ganun magtimpla? Just to make sure na na-dilute mo yung juice, yung powder. So, di ba kasi ilagay mo agad sa pitchel na may tubig, ang hirap kayang haluin. So, ang ginagawa ng iba, lalagay mo nila sa, may baso sila, nilagay nila ano. So, that is what I'm trying to illustrate here. Why? Yung saan mas concentrated? Yung nasa baso o yung nasa pitchel?
Baso po.
Nasa baso
Okay.
po.
Obviously, nasa baso. Pero dinagdagan mo ba yon? More than yung litro pack mo na juice. 2 litro pack ba? Di ba 1 litro pack lang? So, ibig sabihin, same lang yung litro pack, kaya lang ang binawasan mo lang yung pangtunaw. Kasi yung nasa baso, kaya siya sobrang concentrated, kasi onti lang yung ml nung pangtunaw mo. Pero yung nasa pitchel, same siya kasi 1 liter yung litro pack mo, yung I mean 1 liter yung juice mo, pang 1 liter, 1 liter din yung iyong water. So, ibig sabihin, enough. So, kaya hindi siya concentrated. Pero yung isa, dahil nabawasan yung solvent, that's the reason why it's concentrated. Do you get it? So, ganun din po nangyayari if you have dehydration. Pag may dehydration ka, obviously, your blood is concentrated. Kasi, yung konti yung water. No? Konti yung water. No? So, dehydrated ka kasi. So, ano nangyayari sa serum osmolality? Tumataas siya. Right? Ibig sabihin, concentrated. What happens to your hematocrit? What is hematocrit? Do you know what hematocrit is? Obviously, alam niyo hemoglobin. Hemoglobin is your oxygen carriers, right? What about hematocrit?
Volume po ng red blood cells.
So, hematocrit is actually the proportion. Okay. Hematocrit is the proportion of the solute concentrate in the blood, that is your formed elements, versus your liquid portion of the blood. Okay? So, ibig sabihin, may point din naman yung sinabi mo na parang amount ng red blood cells. Kaya lang kasi pag sabi mo hematocrit, meron ka pang RBC result. So, ano yung hematocrit? Hematocrit is the percentage. Okay? It's the percent or the proportion of formed elements to your solvent, which is the liquid portion of the blood. Okay? So, I hope that you're getting that. Yan. Okay. Next, let's continue. Okay. Fluid management. So, what do we do with patients with fluid volume deficit? So, as I've said, so you need to replace that. So, re-replace mo. Oral rehydration. Kaya meron ka namang Orisol, oral rehydration solution. Yun yung ibig sabihin ng Orisol, oral rehydration solution. So, it's the safest and most effective way to reverse dehydration. Increase your fluid intake. Okay? And then of course, kapag hindi kaya yung oral, hindi kayang mapalitan yung maraming masyadong nawala sa kanya, you have your IV therapy. Yan, IV therapy. So it depends on what type of dehydration it is, kung anong IV yung ibibigay. So kapag ito ay dehydration, usually they give you isotonic IV fluid. Ibig sabihin same tone lang. Pero kapag halimbawa meron kang edema, no, kailangan masipsip yung nasa interstitial, so baka bigyan ka ng hypertonic solution para ma-draw out niya yung mga nasa interstitial. Okay? So, health promotion. You have to teach the patient how to prevent fluid volume deficit by drinking the amount necessary for normal functioning, like 8 to 10 glasses of water per day. Ayan. So, for real, how many glasses do you drink per day? In a day. Ayan. Yun ang kasama sa attendance nyo, sagutin nyo yan. Tsaka ngayon yata favorite beverage. Okay, careful monitoring of intake and output. So that's what we do when we are in the hospital. Actually, you can also do that when you're at home. Halimbawa, ikaw yung tao na hindi mo namamalayan, hindi ka pala umiinom masyado ng water kasi nagkakape ka, nagjo-juice ka or something. Eh gusto mong maging healthy yung cells mo, so you can count off your water, no? So halimbawa, meron ka sa ref, 'di ba? Minsan may mga ano doon, pwede kang maglagay ng mga paper, tas may ref magnet ka. So you just count off, oh, ngayon ilan ng glasses na ako. Ayan. So, 1, 2, 3. So, yan. So, parang kina-count off mo kung ilan beses ka nang nakakainom ng water. Or you can have like a water bottle. So, ako yun yung ginawa ko. So, meron akong water bottle. Di ba yung mga water bottle natin, may mga measurement naman kung 500 ml, yung ganon. So, kailangan makaubos ako ng 2 liters of water per day. So, 4 na puno dapat ng 500 ml ko. So, ganon. That's something that you can do to make sure that your skin and, your cells are actually healthy and to prevent fluid volume deficit. So, you can also have a diary. So, yung mga patient natin, pwede natin sila anuhan ng diary. Kaso ang problema kasi pala yung output, yung urinary output. Kasi ano lang yun eh, hindi mo naman usually minimeasure yan. Unless na lang, kayo ba minimeasure niya? Urinary output. Ay, dito ako sa baso iihi. Para ilang basong ihi ba yung nagawa ko for today. So, hindi natin usually minimeasure. So, estimate lang yan madalas, no? That's why, for example, umihi ka, so one urination, mga 250 ml, ini-estimate natin. Pag sinabi mo na, marami-rami yung naihi ko kanina. So, okay, so siguro mga 300 ml, ganun. Kasi you feel the urge to void at 250 ml. Do you know that? So, the first time that you feel the urge to void, ibig sabihin, naiihi ka, mafe-feel mo kapag 250 ml na ang laman ng iyong bladder. Okay? You will feel the urge to void. However, you can still skip it. Pero wag mong i-skip. Pero you can still do that. Ibig sabihin, di ba minsan may mga times pag naiihi ka, pagkakita mo sa CR, may tao pa. Di ba kaya mo namang pigilan na, sige mamaya na. Okay, kasi 250 ml, na-feel mo yung urge to void, pero kaya mo pang i-skip. Now, and then you will again feel the urge to void afterwards. And I think capacity kasi ng urinary bladder nag-vary, pero it's usually 800 ml to 1 liter. 800 ml to 1 liter ang capacity ng bladder mo. Yun yung kaya niyang i-carry. After that, it will overflow. Okay, after halimbawa kinary mo yon, at tas ihi ka na, punong-puno na yung bladder mo kasi 'di ba, uminom ka pa ng habang nasa pila ka papunta sa CR, iniinom mo pa yung mga inumin sa Macau Imperial. Uminom ka pa ng Macau na tea. Eh, gusto mo pa yung malaki, large, no? Eh, naubos mo na habang nakapila ka papunta sa CR. So, obviously, yan, pwedeng punong-puno yung bladder mo, magsispill over yan. Ang tawag natin dyan is overflow incontinence. Kasi puno na siya, kaya may lumabas na. Ano mo yan? Na-try mo yan? Di ba minsan, tapos ang sikip-sikip pa nung ano mo, ano tawag dito? Nung pantalon mo, o kaya yung belt mo, hindi mo pa natanggal. So, na-try nyo na ba yun? Binababa mo pa lang kasabay si urine. What? So you will have a incontinence. Okay? So that's overflow incontinence. Lalo na kung na-feel mo na yung urge, tas di mo pinansin. So ang tama po, you void every 2 hours. Guys, that's the normal. Umiihi ka dapat every 2 hours. Okay. So kung ang klase natin, let's say ay 7 to 11, dapat twice kang umihi. No? Ganon ang normal. Sabi, paano naman yung teacher? Hindi nagbi-break, no? So, sometimes, yun ang problema. I remember one time, I have a friend, ka-UTI siya. Sabi, bakit? Because of your urinary state. Ganito, the reason why you feel the urge to void at 250 ml is so that the urine will not stay in the bladder. Kasi remember, this is your kidneys, no? Let me just open a Jamboard. Sadly, some won't be able to see it again. Okay. But, yes, I'm sharing it. sand. So I'm opening up a Jamboard, and I hope that you can see this. So this is like just like from yesterday. Yay! Okay, so andito na kaagad sila. Okay, so let me just try and draw the draw. Wow, so ambitious. Okay, so let me just try and draw your what do you call this? Your urinary system. So yan. So kung di niyo nagigets, use your imagination. Shannon. Yan. So, this is now your very, very Picasso-like drawing of your urinary system. So, the urinary system, para madali mo ma-memorize, it's composed of your kubu. Yan. Kidneys, ureters, ureters, bladder, urethra. Ah, 'di ba? Siyempre for males, meron silang special organ that's included. It's your prostate gland, and the prostate gland actually encircles their urethra. Okay? So when you talk about kidneys, ureters, bladder, urethra, so etong urinary bladder mo, so obviously in your kidneys is where your urine is formed sa kidney natin. And then the ureters our passageway so that the kidneys will go to the bladder. Now, the bladder will store your urine until such time that you feel the urge to void, and it will be now passed through the urethra. Okay. Now, the thing about the bladder is that sabi natin at 250 ml, so you feel your urge to void. Urge to void. Now, you can still hold it, okay? Pero you should prefer not to kasi what happens there is if you do not urinate, it will lead to your urinary stasis, okay? So pag sinabi mong urinary stasis, ang ibig sabihin lang yan is that the urine is staying in the bladder. Now, urinary stasis will or could, kung halimbawang, matagal siya nagstay doon, no? Kasi hindi mo na ulit mafe-feel yung urge to void until the bladder stretches out. Okay? Eh, ang problema mo dyan, okay, hindi naman lahat nagvo-void just for the reason that, ay, it's naka 2 hours na akong di umiihi, makaihi nga. Hindi gano'n, no? So, we usually void based on urge. Tama ba? Kayo ganun ba? Do you void based on urge? Hindi dahil sa time? No, hindi naman kayo yung parang conscious like na, ay, parang 2 hours na akong di nag-iihi maka-CR nga. Kahit di ka naiihi. So, ibig sabihin, we don't void unless we feel the urge. Eh, ang problema mo, bago ka pa maka 250 ml, no? Yun ang problema mo. Sometimes, kapag hindi ka umiinom ng tubig, it takes a while before your bladder is filled to 250 ml. So, ibig sabihin, yung urine, andun lang sa bladder mo. Nakastay put siya dun sa bladder mo. And urinary stasis leads to your bacterial growth. Ayan. Yan ang favorite ng bacteria. Kasi, nakastay si urine doon. Alam mo ang bacteria, ganito lagi nyo isipin. Ang bacteria, favorite niya, basa. Okay? If it's wet, they love it. If it's glucose-filled, they love it. Okay? So, yan ang mga favorite na. Ibig sabihin, may makakain sila tapos it's wet. You know? So, syempre, yung urine, favorite yan ng bacteria. So, ang bacterial growth na usually makikita mo dyan is may pneumotic din tayo doon, KEPS. Ayan. Sabi ni ma'am, ay, ma'am, ano yung KEPS? Ang pangit. Okay. Pagpasensya na, yun ang pneumonic. Yan ang mga nandyan eh. So, you have Klebsiella. Diba? Okay. KEPS. E. coli. P. Proteus. KEPS. Pseudomonas. Kaya siya, kasi silent P yun eh. Pseudomonas. Yan. So these are the common bacteria found in your urethra that goes up to the bladder whenever there's urinary stasis. So pag nagstay siya doon na matagal yung urine mo, pupunta dyan. Usually, ang main culprit is E. coli. Ayan. Yan ang ating main culprit dyan. Si E. coli. Ito. E. coli. Bakit ma'am si E. coli? Kasi yan ang iyong what do you call this? E. coli is your microorganism, resident bacteria of the colon. So yung inyong intestine, ang resident bacteria niyan si E. coli. So ibig pong sabihin, kapag ikaw ay hindi properly yung pagwa-wipe mo, no? For females especially, hindi hygienic, no, yung pagwa-wipe mo, si E. coli from the anus, pwede siya from the feces, no? Pwede siya mapunta sa iyong urethra. So, yun, magkaka-UTI ka. Okay? So, another, so once there's bacterial growth, sabi natin, no, may urinary stasis, nagkaroon ng bacterial growth, so, ang mangyayari ngayon, the urine, okay, so the UTI, so you will have lower UTI. Pero that UTI can still ascend. Ascending infection. So, aakyat siya sa ureters, papunta sa kidneys. So, meron ka na ngayong upper UTI, upper urinary tract infection. Meaning, ang medical term natin is pyelonephritis. Ayan. Kapag ka lower UTI, ang term natin ay cystitis. Because it's the bladder that is inflamed. Okay. Umaakyat siya ngayon. So, ibig pong sabihin, para maiwasan mo na yung urine mo magstay sa bladder mo ng matagal at ma-feel mo yung urge na umihi, kailangan uminom ka ng tubig. Maraming tubig para pag nakainom ka, so every hour, let's say inom ka ng 1 glass of water, pag gano'n, para ma-feel mo na, kailangan ko umihi. Ayan. So kasi mapupuno yung iyong bladder, so maiisip mo na, ma-feel mo yung urge to void. Okay? So this is what happens when you have, if you don't have the urge to void. Okay? So next is your assessment. So health history, pag fluid volume deficit, no? So let me just remove this board. Okay, so you have there your, let's go back to our PowerPoint. So let's continue. So assessment natin for fluid volume deficit will be health history. So ano ba mga nangyari? Baka may nakain siya, kaya nag-lead yun sa diarrhea and all that. Physical assessment, so yun yung check for skin turgor, check for pallor, check for, so you check for your eyeballs, no? So usually kapag dehydrated, sunken eyeballs. No? So yung mga ganyan. Then you have there your priorities of care. So is to restore adequate fluid volume. That's the reason why sabi nga natin oral rehydration and also intravenous fluid. So isa pa palang makikita mo kapag ang patient dehydrated is hindi masyadong mahanap ng doctor or ng nurse yung kanyang veins. Yung ilalagyan siya ng intravenous fluid, hindi mahanap kasi parang nag-shrink na yung veins niya kasi nga mababa yung pressure, kulang yung blood volume, no? So ganun yung nangyayari. Actually I had amoebiasis before, after we did medical mission. Pagpunta namin dun sa na-stranded po kami. So yung water namin hindi siya enough. So wala kaming choice kundi uminom ng tubig nung sa island na napuntahan namin during medical mission. So what happens there is pag uwi ko, yun na, liquid stools. Alam niyo yung pag nagpupoop ka, yung feeling na wala ka nang mailabas. Pero nandun ka pa rin. Gusto pa rin niya mag-poop. Ayan. So that's amoebiasis. And sobrang hinang-hina na ako. Hindi ko mabuksan yung takip ng Gatorade. Sobrang hinang-hina na. Tapos nagpunta ako sa syempre alam mo naman nurse, no? Ayaw magpa-confine. Nagpunta ako sa sa co-teacher ko na nurse. nagpapa-insert ako ng IV. Siguro nakailang insert siya, try siya. Hindi ayaw pumasok. Hindi niya makita yung veins ko. So nag-blind ano na lang siya, blind insertion. Yung hindi niya nakikita yung veins pero tinusok niya kasi nafe-feel niya. Yun yung mga magagaling na sa ER, no? Kaya nila yon. So, yun, finally nakuha niya yung vein. Tapos yun, umuwi ako naka-tricycle, hawak-hawak ko yung swero, ganun. So, yeah, because that's you need to restore your fluid volume kasi hindi na kaya eh. Nagiinom ako ng water ako, gator electrolytes ako pero hindi na kaya, hindi ma-restore. So I needed to have your intravenous. Ayan. Ayan. So that's something that you should consider when you do your fluid volume or when you have patients with fluid volume deficit is what type of fluid volume deficit it is para appropriate yung IV na maibigay. So yung sa akin 0.9% sodium chloride which is your isotonic solution. Okay. So just to replace the fluids. Okay, so what are the diagnoses that is for patients with fluid volume deficit? So you have their fluid volume deficit or deficient fluid volume, ineffective tissue perfusion. Ma'am, paano ko makikita to? Yan, so yan yung papasok yung cold clammy skin, decreased capillary refill, ayan, pag pinindot mo to, nag-blanch siya pero it takes about more than 2 seconds bago dumating. So it's a significant ineffective tissue perfusion. Risk for injury. Ma'am, bakit may risk for injury? If you have decreased fluid volume, that is a problem. So, do you have a risk for injury? Kasi pwedeng makulangan ng oxygenated blood ang mapupunta sa mga major organs. So, you have the risk. Okay, continuity of care means assess patient's understanding of the cause of the deficit. So, you have to educate your patient. Okay, so that is fluid volume deficit. Next, let's talk about fluid volume excess. Okay, for patients with fluid volume excess, so this is obviously from the word itself, excess fluid volume. So maraming fluid na na-retain sa katawan. So it's caused by the abnormal retention of water and sodium in approximately the same proportion. So again, we're not yet considering here some of the diseases that alters your sodium levels, yung mga ganyan. So we're looking into isotonic dehydration and isotonic fluid excess. Okay. So what are the possible causes of fluid volume excess? So you have the following. You have rich, as your mnemonic. R is for renal failure. Ma'am, bakit po nagkakaroon ng fluid volume excess pag may renal failure? Siyempre, ang kidneys mo, isang function niya is to create urine. 'Di ba? Para itapon yung mga waste. Eh, ang problema mo, yung kidney mo nag-fail na, so hindi siya nagka-create ng urine. So, nasan yung urine? Na supposed to be urine, nasa blood mo. It stays there. So you have fluid volume excess. Next is increased sodium intake. Ayan. So increased sodium, so it's in the diet. So increased sodium intake can also cause fluid volume excess. Or the sodium retention can cause fluid volume excess. Then liver cirrhosis can lead to edema. Bakit? Sabi natin kanina, pagka meron kang liver disease, it causes hypoalbuminemia. So si fluid na nasa blood mo, pwedeng mapunta sa extra or sa iyong sa mga third spaces wherein it's unusable like your peritoneum. So magkakaroon ka ng ascites. So it can lead to your fluid volume excess. Tapos magigain ka ng weight dyan. Then it can lead to isa pa possible cause is actually your heart failure. So heart failure, remember if meron kang specifically right-sided heart failure, it leads to your congestion, systemic congestion. So ang heart failure, meron tayong 2 types. Naalala niyo ba? Tapos natin kayo dito, cardio. 2 types of heart failure, right? You have right-sided heart failure, left-sided heart failure. Pag left-sided heart failure, usually it's the first side to fail, left side. So left-sided heart failure, tatandaan mo lang lungs. Pag left side, lungs, L for L. Left side heart failure, lungs ang mga signs and symptoms. You have crackles, dyspnea, you have frothy, blood tinge sputum, no? So lahat yung mga signs and symptoms mo usually has something to do with the lungs pag left-sided. Pag right-sided heart failure, it's all about systemic congestion or fluid retention. Pag right-sided heart failure, kung naalala niyo pa sa discussion niyo, you have jugular vein distension, you have your ankle edema, no? Yan yung mga ascites, ano pa ba? Liver or portal hypertension. So, meron kang fluid volume excess kapag meron kang heart failure. Okay, because the heart cannot pump the blood appropriately anymore. That's why it leads to your fluid volume excess. Okay. S. Ooh, newborn screening. Okay. Okay. So let's continue. Now, what's the pathophysiology of fluid volume excess? So, as I've told you, you have heart failure, renal failure, liver cirrhosis, adrenal gland disorders. Okay, dito na papasok si Cushing's disease. Okay, Cushing's disease. So later on, we'll talk more about that. You have your corticosteroid administration. Okay, because your corticosteroids, well, it leads to fluid volume excess because of your aldosterone. No, si aldosterone, okay, causes sodium and water retention. Okay, so yun din yung Cushing's. Then you have stress condition causing the release of your antidiuretic hormone and aldosterone, excessive sodium intake, and side effects of medication. Now, okay, so let me now discuss to you, tapusin ko muna yung fluid volume excess, then discuss tayo ng disease. Manifestation. So, pagka meron ka fluid volume excess, okay, so, pag extracellular fluid volume excess, so what happens here is you can have what we call your circulatory overload. So, ibig sabihin, masyadong marami ang blood inside your blood vessels. So, it leads to your circulatory overload. Okay? And then you have your interstitial. Okay? It means it's peripheral. It's generalized edema. Ayan, yan yung nangyayari. So, it's peripheral, usually, yung limbs, no? And it's the result of your it will result to generalized edema. Mamanasid ka. Okay? So, that is fluid volume excess for interstitial, in between the cells. Okay. So what about complication? So it can lead to your CHF, congestive heart failure. Nabanggit na natin kanina. Kasi bakit ma'am ako magkaroon ng congestive heart failure kapag may fluid volume excess? Because it's additional workload for the heart. Pag dumadami, yung iba kasi hindi nila masyadong pinapansin ang madaming blood. Pag marami kang blood volume, ang nangyayari, lahat naman ng dugo mo, ipapump ng puso mo. So kung mas marami yan, blood mo, kesa sa kailangan ng katawan mo, it's added pressure to your heart to pump it out. Eh, ang puso mo walang rest. Tama ba? 24/7, it's being used. Tapos, dadagdagan mo pa ng volume. Kamusta naman yan? So, ang nangyayari, the heart will fail. So, ang weird, no? Heart failure can lead to excess of fluid, but excess of fluid can also lead to heart failure. Taray! Okay, next is diagnosis. How do we diagnose fluid volume excess? Serum osmolality. So, ano nangyayari pag sobrang daming solvent? Sa tingin niyo, ano nangyayari supposed to be sa electrolytes?
Decrease po.
Yes. So, ang nangyayari, by virtue, it decreases. No? Kasi masyadong marami ang iyong diluent. Okay? Yung iyong pangtunaw, yung solvent mo. Let me give you another example for that. Ayan. SKL. Share ko lang. Okay. When I was studying, my first boyfriend, okay, so, huwag niyo akong gayahin. First boyfriend ko ay third year college, or, yeah, magpo-fourth year college ako. So, nung time na yon, hindi pa ganun meron na, pero hindi pa ganun kadami yung mga 3-in-1. Siyempre kayo, familiar kayo sa kape, di ba? Yung 3-in-1. Okay. Nung time namin, siguro first year college, ang uso pa noon, yung, alam niyo ba yung coffee stick siya? tas yung creamer naka-sachet din, tas sugar, di ba? So yung time na hiwa-hiwala yan. Tapos pero nung college ako, doon nag-start yung mga 3-in-1, ganun magkakasama. So, yung ex ko, my first boyfriend, sabi niya, sabi ko sa kanya, ano tawagan namin? Mine? So, inisip ko talaga. Mine? So, kumain punta ako dyan sa boarding house. So, kape tayo. Syempre, Baguio yun. Masarap magkape, di ba? Sabi ko, uy, kape tayo. Magpainit ka ng water. Tapos, sabi niya, sige, ayan. So, nagdala ako ng 3-in-1. Ayan. Kasi di ba? Yung para mabilis timplahin, gano'n. So, pagpunta ko doon, sa bayan, hindi nagtimpla na siya, ay, nagpainit na siya ng tubig. Ay! Bro, sorry. Wait lang. Lumabas yung brother ko. Ma-exposure ka. Okay lang, 40 lang to. 40 students. Okay. Ayan. And that was my brother. Hindi ko siya maibenta, no? Kasi, pero single pa siya. Pero may girlfriend na kasi. So, he's an electrical engineer. And if you're interested, char lang. Okay, so, dati binibenta-benta ko siya kasi single pa siya. Pero may girlfriend na siya. So, flight attendant. Diba? Social. Wish ko lang naman, may free flights ba dyan? Qatar Airways. Qatar Airways eh. So, anyway, so, yun na. So, si X, pagdating ko sa boarding house niya, didala ko yung 3-in-1, tapos ayun na yung mug. So, syempre, binuksan ko yung 3-in-1. Tapos, ilalagay ko dun sa mug, yung 3-in-1. Sabi niya sa akin, ilalagay mo lahat yan? Sabi ko, Tapos, nilagay ko na dun sa baso yung 3-in-1. Tapos, lalagyan ko na ng hot water. Sabi niya, hoy, anong ginagawa mo? Sabi niya sa akin. Sabi ko, ha? Nagtitimpla ng kape. Tapos sabi niya sa akin, ba't mo ilalagay lahat yan? Sabi ko, bakit? Sabi ko, bakit? Lahat, gusto ko lahat. Bakit? Sabi niya, 3-in-1 yan. Sabi niya sa akin, 3 timplahan. Sabi ko, ha? Sabi ko sa kanya, what? Tapos bigla akong napaisip, salamat ka, gwapo ka. Sorry lang. Alam mo, so parang, sige, hindi. Sabi ko, ano ba yun? Tapos tumawa ko. Sabi ko, joke ba yan? Ano ba? Tapos sabi niya, tapos seryoso siya. Alam mo yun, akala mo joke, pero seryoso. Tapos sabi niya, 3-in-1. Sabi niya sa akin, 3-in-1 yan, 3 timplahan yan. Sabi ko, hindi. Sabi ko, ang ibig sabihin ng 3-in-1, andun na yung coffee, creamer, at saka sugar. Sabi ko sa kanya. Tapos isip ko, oh my gosh, what am I doing here? So, huwag niyo ako i-judge. Lead singer siya sa banda. Alam mo yun? Tapos nagigitara. Ayan. So, syempre, alam mo naman pag babae ka, hindi mo naman number 1, intellectual. Hindi naman uso yun dati. Pagka mga bata-bata ka, ang una mong iisip, wow, lead guitarist, gano'n ang ano mo. So, sabi niya sa akin, tapos alam mo, sobrang serious siya. Sabi niya, ini-insist niya. Alam niyo yun? Ini-insist niya. Sabi niya, hindi, sa amin, sabi niya, 3 timplahan yan. So, can you imagine, 3 timplahan mo, isang 3-in-1? Kung gaano ka-diluted yun. So, sabi ko sa kanya, hindi, ganito na lang. Sabi ko, tikman mo. Di ba, yun ang pinaka-best eh. Experiential learning. Kumbaga, scientific tayo. Okay. So, sabi ko, tikman mo. Sabi ko, pagtikim niya, ang pait. Sabi niya, pinapanindigan niya. Sabi niya, ang pait. Sabi niya ganun. So, sabi ko sa kanya, kasi yun ang alam ko sa 3-in-1. Pati ako kinwestiyon ko na yung sarili kong knowledge. So, ayan. So, anyway, so can you imagine, 3-in-1 na isang sachet, ang gagamitin mo para i-dilute siya 3 baso ng kape. Ano kayang lasa nun? Anong lasa ng kape mo kapag 3 mug ang pinag-dilute mo sa isang 3-in-1? Although yung 3-in-1, hindi naman nababago. Diba? Hindi nababago, hindi mo binawasan yung 3-in-1. Same pa rin yung amount niya. Pero the fact na dinagdagan mo ng tatlong mugs ng hot water, it becomes diluted. And that is what happens when you have fluid volume excess. No? Pag may fluid volume excess ka, same talaga. Actually, hindi naman nabago yung electrolytes mo. Pero by virtue of adding more water to it, it becomes diluted. So your blood is diluted. Okay? So that is what happens when you have fluid volume excess. So decrease serum osmolality. O, bakit ma'am hindi concentrated? Okay, decrease hematocrit. Bakit na-decrease ang hematocrit ko? Eh kasi, nami mong taga-tunaw. No? So, yan. So, I hope that yung, yung experience ko, nakakatawa talaga guys, kapag ka, alam mo yun, yung pagka ikaw ay may boyfriend, tapos eventually nakapag-asawa ka na, parang pag ni-recall mo, nakakatawa yung mga pinag-aawayin nyo dati, tapos naisip mo sa sarili mo, ba't ko nagustuhan to? Pag hindi mo na siya love, nandun yung realization, di ba? Oy, aminin yung may mga ex dyan. Pag naka-move on ka na, di ba? Pero pag di ka pa nakaka-move on, syempre parang, the one that got away. You know, thought ga. Tama yun? The one that got away. Yun. Pero kapag ka, alam mo yun, naka-move on ka na, oh my gosh, nagustuhan ko to. Ang bobo ko pala. Ayan. So, ayun mga ganap na paisip ka bigla. Anyway, so that is serum electrolytes. Pero syempre, you always learn from any experience. Ayan. So, yeah, serum hematocrit will be decreased. Hemoglobin often decreased. Then you have your renal and liver function will also be checked. You know, so when you have fluid volume excess. Okay? Okay. Next is for medication. So, anong gagawin natin? Ang dami-dami ng fluid sa katawan. Palabasin ang mga fluid na yan. So, by the use of your diuretics. Okay lang. Okay. So, okay lang po yung mga nawawala. Ang akin lang, medyo sad ako for you kasi you were not able to join the lecture. Kasi sometimes, you know, you need the lecture for you to be able to understand what is there in the notes, no? Anyway, so for medications, you have diuretics. Now, we have different types of diuretics. Andyan po yan, nakalagay loop diuretic. The most common diuretic is the loop diuretic. Dyan pumapasok si furosemide. Okay, loop diuretic yan. So, it works in the loop to cause water to be flushed out. No? So, that's your loop diuretic, that's your Lasix. Yan, yung mga common, yung furosemide. It's your name of the medication. And then you have your thiazide type. So the thiazide type diuretic, example niyan is your hydrochlorothiazide. So that's another of your thiazide diuretics. And then you have your potassium sparing. Ito yung kasing isang problem natin pag ikaw ay nagda-diuretics at hindi siya potassium sparing, you can have hypokalemia. Bakit? Kapag umiihi ka, isa sa mga nalalabas sa urine mo is potassium. So, pagka ngayon nagtitake ka ng diuretics, you have to check for your potassium, baka magkaroon ka ng hypokalemia. Kasi every time umihi siya, para malabas yung fluids, no, lumalabas din si potassium. So, at risk for hypokalemia. Now, that's why your doctors might give you, kapag ang problema lang ay edema, fluid volume excess, at hindi ka naman sobrang daming potassium, so it can lead to hypokalemia. That's why they give your potassium-sparing diuretics. And ang pinaka-common na potassium-sparing diuretics is your spironolactone. Okay, let me write it down. Okay, so you have your most common loop diuretic is your furosemide or Lasix. So, then you have your thiazide. So, lahat ng mga thiazide type, may thiazide sa dulo. Hydrochlorothiazide. And then you have your potassium sparing. So, pag sabi mong potassium sparing, it's good. Ibig sabihin, pagka umihi ka, hindi kasamang lalabas si potassium. So, ang pinaka-common is your spironolactone. I typed it up. Nolactone yan. Spironolactone. potassium sparing. Okay. And then look at the treatment. So you have your fluid management and your dietary management. Okay. So it means that, okay, wait lang, may dadaan. Okay. So kapag ka fluid management, so syempre fluid volume excess na siya. Naka-strict INO monitoring ka. Tapos, posible na magkaroon ka rin ng fluid restrictions. So pag fluid restrictions, lalo na may mga kidney disease, kawawa sila, no? Alam mo yung may mga kidney problem kasi nagkakaroon ng fluid volume excess kasi hindi nga sila nakakaihi. Yung mga kailangan pa nila magpa-hemodialysis, peritoneal dialysis. Kasi pag hindi, talagang magbo-bloat sila, no? Kasi may fluid retention. So, ang naka-strict fluid restriction, hirap sila. Kasi, ang pwede lang nilang inumin, okay, is like 600 ml, 500 to 600 ml, 600 ml of water plus urinary output of yesterday. Ano ibig sabihin yan? So, ang pwede mo lang, di ba naka-strict monitoring sila na INO? Ito yung mga renal failure, strict monitoring sila na INO. So, halimbawa, may renal failure sila, so ang ihi nila konting-konti. So, for example, mga oliguria, anuria yan. Halimbawa, ang inihi ko kahapon ay 200 ml lang. Halimbawa. Tapos, ngayon, ang pwede ko lang inumin, 500 plus 200 ml, 700 ml. Ganun ang computation. So, isipin mo, 700 ml lang, pwede lang niyang inumin in 24 hours. 700 ml. So, kailangan bilang isang nurse, ang gagawin mo dyan, distribute throughout the day ang kanyang 700 ml. Kasi remember, 500 to 600 ml of water plus urinary output niya of yesterday, yun lang ang pwede niyang inumin. So you have to distribute throughout the day. Kasi halimbawa, breakfast. Di ba minsan, no? Gano'ng kalit lang 500 ml? Magkape ka. Oh. Ang kape mo, 220 ml or 250 ml. Naalala ko kaya uminom akong kape. Ayan, so halimbawa ganun. Ubus na agad, no? Pag 250 ml. Kape, breakfast pa lang yun. Inom ka pa. No? So that's the reason why sobrang hirap sila dito. Yung mga kidney failure, isa sa mga nirereklamo nila is the fluids and dietary restrictions. Kasi ang hirap yung pag-uhaw ka na, pero bawal ka uminom. Sobrang effort sa kanila. No? So, isa sa mga pwede mo magawa pagka yung, lalo na yung, na-try nyo na ba yun yung, do you know that the only reason that you can swallow is because of your saliva? Pagka natuyuan ka ng laway, hindi ka makalunok. Na-try nyo na po. Because if you have that, and that is the problem, no? If you have your fluid restrictions, tapos dry mouth ka na, kasi di ba you feel like, you want to drink something and yet you can't because you have the fluid restrictions. So what you can do is to give your patient ice chips. So that's one thing that we do. So ice chips na lang para magkaroon siya ng laway. Kasi bawal nga siya ng fluids. Ang strict pa naman nito. Yeah. Okay, and then you have there your dietary management. So isa sa mga pinakamahirap i-follow, especially for patients with kidney problems, no? So it's very difficult to follow your dietary restrictions. So we'll talk about more of your kidney diseases maybe as we go along. Okay, so health promotion. So you have to instruct the patient about the relationship of sodium intake and water retention, because the more sodium that you take in, the more water you will retain. Kasi alam natin, di ba? So, ibig sabihin, meron ka rin sodium restrictions. Kasi alam natin, sodium is hydrophilic. Kung nasan siya, nandun si tubig. So, ibig sabihin, if the sodium is retained, marami kang kinain na sodium, high in sodium, like chips, mga high in sodium. You have basta yung mga salty foods, ayan. So, kinain mo, Okay? Ang nangyari, mas mag-retain ka ng water. So you have to figure that out. You have to follow your dietary recommendations. Then for your assessment, you have your physical assessment, weighing, of course. Remember, ang nabanggit ko sa iyo, 1 kilogram of weight gained, 1 kilogram or 1 liter of fluid retained. Same thing, 1 kilogram of weight loss is equivalent to 1 liter of fluid excreted out. Okay? Yung sa dehydration. So, eto naman, iyan yung ano natin. Basta 1 kilo is equivalent to 1 liter. Okay. So, you have there your vital signs. So, paano ngayon ang fluid volume excess? So, kung kapag ka shock or your hypovolemia, you have your hypotachy-tachy. What about for fluid volume excess? So, the thing about fluid volume excess is that the vital signs will actually reflect it as well as your. Now, the heart compensates, no? So, the heart compensates for a while by pumping out the excess fluid volume, pero eventually, magdi-decrease yan kapag ka napagod na yan. Okay? And then you have your circulatory signs. Anong mga signs na meron kang fluid volume excess? So, you have your jugular vein distension. Pag pinaharap mo yung pasyente mo to the left, makikita mo dito yung kanyang jugular vein, tas makikita mo ang pasyente mo extended yung kanyang jugular vein. So that's jugular vein distension. Other circulatory signs will be lungs. So there is fluid in the lungs. So isang example na may fluid po sa iyong lungs will be your crackles, abnormal breath sounds. Okay, you will have difficulty of breathing, like your dyspnea. And when you cough out, okay, meron kang frothy, blood-tinged sputum. Frothy, blood-tinged sputum. Ma'am, bakit siya frothy? Frothy. Saan nyo nakikita yung frothy? Oh, nagdi-drink kayo, diba? Frothy, yung, ibig sabihin, mabula. Diba? Kapag ka na may umorder ka ng drink, diba? Frothy. Like your, ano mga drinks? Mga cappuccino, mga frap, gano'n na, frothy. So, pagka frothy, ibig sabihin, may air. So, pag nag-sputum ka, pag may phlegm ka, tas parang may bula-bula yung phlegm, ibig sabihin, may air. So, galing sa lungs, so frothy siya, okay? And then, blood tinge. Yan. Yan ang sign na meron kang pulmonary congestion because of fluid volume excess. Then you have your urinary output. Obviously, for patients with fluid volume excess, supposed to be mas mataas ang fluid volume or ang urinary output. Supposed to be. Pero kapag may kidney disease ka, kasi nga yun ang cause ng iyong fluid volume excess, so meron kang oliguria or anuria. Pero kapag ka normal lang na marami ka lang talagang fluid retained, maraming beses ka rin mag-urinate. Okay? Then you have there your mental status. Bakit mental status? Yan ang problema mo. Kapag you have fluid volume excess, tas ang dahilan ay kidney disorder, alam mo ang iyong ammonia and your urea, okay, crosses yung mga nitrogenous waste na tinatawag natin, supposed to be tinatanggal yan ng iyong kidneys from the blood. Pag di nag-work yung kidneys mo, magre-remain yung nitrogenous wastes mo in the blood and it crosses your blood-brain barrier, causing you to have your deterioration in the level of consciousness. So magkakaroon ka ng altered mental status or altered level of consciousness hanggang makomatose. No? So yun yung isang mga problem na may mga kidney disorders or kidney failure. Because the nitrogenous waste crosses the blood-brain barrier. Ayan. Okay? So what about your priority? Sorry. Your priority of care will be to make sure that your cardiovascular system and respiratory system are functioning properly. So this is, again, as I've told you, additional effort to your heart if you add fluids to your blood. Kasi pag fluid volume excess, at lahat yan ipapump out pa rin po ng iyong puso hanggang siya ay mag-fail. Okay, and then you have there your diagnosis. So the diagnosis will include fluid volume excess. Then you have risk for impaired skin integrity. Ma'am, bakit impaired ang skin integrity ko? Kapag edema, okay, pag meron kang edema, lagi ka may impaired skin integrity if you have edema. Kasi bakit? Kapag sa interstitial fluid, mas at risk for injury yun. No? Then you have impaired gas exchange. Ma'am, bakit ako impaired gas exchange? Kasi remember, meron kang congestion of your blood in the pulmonary circulation. So ngayon, si gas exchange, impaired na siya. Kasi pwedeng may fluids ka rin sa pleura. So hindi makapag-inflate-deflate ng mabuti yung iyong alveoli. Impaired gas exchange. Okay. So what do we do for fluid volume excess? Teach to manage underlying costs. So meron bang, anong dahilan ng fluid volume excess? Ito ba ay simple diet? O baka naman meron siyang problems with kidney. So kailangan mong i-treat yon. No? Kailangan ma-manage yon. Prevent future episodes of excess fluid volume. Okay? So this is what you do for patients with fluid volume excess. Okay, let's compare it in a table. So kapag ka may fluid volume deficit, everything is increased. Tingnan nyo to. Increased serum osmolarity, increased urine osmolarity, increased BUN and creatinine. So BUN stands for blood urea nitrogen. Okay? So it is the byproduct of protein metabolism. Pag kumain ka, okay, ng protein, okay, like your meat or whatever protein sources that, meron siyang byproduct of metabolism. Di ba amino acid yan? So pag minametabolize siya from the protein, papunta sa amino acid para magamit mo ng bodybuilding ng iyong katawan, it will now have a byproduct known as BUN, blood urea nitrogen. Okay? Normal values is 10 to 20 milligrams per deciliter. Now, what happens now with patients with increase or rather deficit of fluid volume? Dadami by virtue yung lahat ng solute. BUN and CREA is solute. Kaya dadami siya. Increase. Then you have serum osmolarity, increase. Blood concentration. Urine concentration, increase. Ma'am, ba't increase din ang urine concentration? Kasi nga, onti lang yung iniihi mo. So, pag konting ihi mo, ang gagawin ng kidney, ko-concentrate na niya yun mabuti. Kaya, what happens is you have increased urine osmolarity. Then, hemoglobin and hematocrit is also increased. As I've told you, hematocrit is the number or percentage of formed elements in the blood versus your liquid portion. So, anong treatment of care? It's there already. So, you have INO monitoring, replace fluids, give IV. And then for fluid volume excess, lahat decrease. Your intervention is strict INO monitoring again. Fluid restrictions, okay? Nabanggit ko na yan kanina. Sodium restriction, and then daily weight. Actually, for both, you do daily weight. No? So again, pag daily weight, ano nga yung tatlong same? Same, three same.
Same clothes.
Okay.
Sale and
Same,
time.
same time.
Same
Good.
time.
Okay, so it means that you recall it. Okay, so that is
Same
what,
scale, same time.
yes, same scale, same time, same clothes. Okay, daily weight. Eh ma'am, nasa community kami. Walang weighing scale. Sabi sa sa question. Walang weighing scale. Paano mo malalaman ang fluid retention? So isang way to account for fluid retention kung walang weighing scale is your abdominal girth. So tape measure. Kaya nga sa inyong OB bag, remember your OB bag? Nung chine-check siya, di ba part yun ng tape measure? Pang-measure din yun ng kanyang ascites. Kasi minsan nun, yung pag-measure nun is you use a tape measure pag walang weighing scale. Pero syempre, mas accurate weighing scale. Pag wala lang option, tape measure. Okay, you good? Okay. So these are the common administered IV fluids. Okay, yung isotonic, hypertonic. Tingnan ko kung here. So let's look first at your isotonic solution. So sabi nga natin, your yan. Ang most common or your plain NSS. Yan. So your plain NS solution will be your normal saline. That's 0.9% sodium chloride. That's isotonic. Your plain LRS solution, lactated ringer solution, is also isotonic in nature. So usually, ito yung mga binibigay pag fluid volume deficit. No? Then you have there your plasma light 148 and your D5 water. 5% dextrose water. These are all isotonic solution. Okay. Anong nursing implication daw pag nag-administer ka ng isotonic? Monitor for fluid overload. So meron dyan, do not administer LRS to patients with severe liver disease because of the liver's inability to convert your bicarbs. Yan. So if administering LRS solution or LRS, monitor for potassium levels and cardiac rhythm. Okay. If abnormal, notify healthcare provider. Kasi yung lactated ringer solution, yan, may kasama siyang potassium. Okay. Then you have your hypotonic solution. So pag hypotonic, less than 0.9% sodium chloride. Okay. Anong ginagawa ng mga hypotonic solution sa cell? Pag hypotonic ka, ibig sabihin, yung inintroduce mo po sa kanyang blood vessel ay kulang ng solute. So ano mangyayari? Mas maraming solute ang inside the cell. So ang gagawin ng hypotonic solution, yung fluids niya papasok sa cells mo. So yung cells mo magsuswell siya. So usually it's used to reverse. It could reverse cellular dehydration. Hypotonic solutions. Okay, so kasi nga konti yung solutes niya. So di ba alam mo by the process of solute concentration, diffusion from higher concentration to lower concentration. So ang nangyayari ngayon si solute mo or rather si fluid mo napunta inside the cell. It can cause the cell to burst actually kapag di siya na-monitor appropriately. Okay, so next is hypertonic solution. So pag hypertonic solution, example niyan is your D5 normal D5NS. You have D5, pag nakita mo yung D5 except for D5 water. So pagka water, D10 water. Okay? Tingnan niyo po dito sa inyong hypertonic solutions. So you have there 10% dextrose in water, D10 water. Pag D5 water, isotonic. Then you have 3% sodium chloride, ibig sabihin mas mataas sa 0.9%. 5% sodium chloride, okay? And then of course, your parenteral nutrition solutions. So pag sabi mong parenteral nutrition solutions, ito po yung TPN. Yung binibigay natin sa mga patient na usually hindi sila makakain oral, tapos hindi rin pwede NGT. So diretso na sa dugo niya ang iyong nutrients. Yun po yung total parenteral nutrition or parenteral nutrition solution. So, a hypertonic solution, anong ginagawa niya sa cell? So, pag hypertonic, marami siyang solute. So, yung fluid sa cell or yung fluid sa interstitial space, pupunta yan sa blood. Okay? So, ganun ang ginagawa niya. That's why it causes the cells to shrink. So, hypertonic solution causes cells to shrink. Okay. Okay. Let me, yeah, it's the end. Okay. Yeah, okay lang. Sabi mo kay Marekit, okay lang. Recorded naman yung session. Do you want this recording to be in the Moodle?
Yes po.
Sige. I-upload ko na lang. Kasi mabilis akong magsalita eh. Yeah. So, mga 200 words per minute. Mahirap i-type. Kaya yung mga nagdo-notes na inis eh. Ano daw? Sabi ni Man? Ano daw yun? Ayan. Kapag naka-video, kita-kita namin yun. Lalo na pag nilipat, tapos di ka pa tapos kumopya. Di ba? Parang, buti nga nasa Moodle na to eh. Di ba? Yung PowerPoint. Pero yung mga estudyante, lalo na sa school, pag face-to-face. Yung di pa tapos kumopya, tapos nilipat mo yung PowerPoint, yung mga estudyante parang, bigla nagiging serious. Nagno-notes sila. Yung iba may patapon ballpen pa. Ganun. Kitang-kita kaya. Kami pag, yung mga teachers, kahit nasa unahan yan, kita naman mga pinaggagawa nyo. Yung tipong, nag-send ka ng text, tapos biglang gagano ka sa teacher mo. As if naman nagigets mo. May payes ka niya na. Kakasend mo ng text, di ka nakikinig eh. Ayun, sa mga ganon. Nawala ang data connection. Okay. Okay lang, Miss Facundo. Sakto ka kasi dismiss na. Sakto lang yung pagbalik mo. Tapos na. Okay? So, this will be your, ito po mga discuss natin will be part of your quiz next week. Okay. So, next week, we will also discuss, so yung mga nabanggit ko, no, let me just check. Ayoko kasi mag-overstep ng topic kasi baka may magdi-discuss ng endocrine. So, I'm gonna ask muna kung ako magdi-discuss on. So, if I will be the one discussing it, I'm gonna discuss. If not, I'm gonna go to electrolytes already. So, we will discuss electrolytes next week. Hyper-hypo ng bawat electrolyte. So, like, hypercalcemia, hypocalcemia, hypermagnesemia, hypomagnesemia, hyper. And then after that, we'll discuss burns. I'm sure ako ang magbaburns. And then maybe endocrine diseases, if I'll be the one who'll be discussing that. Okay, so yes, that's it. Okay, so I'll see you later on at 1. Kasi kayo din ang estudyante ko sa research. Yay! What? So research will be discussing theoretical frameworks. So I'm gonna try to give you some notes on how to actually utilize your theoretical frameworks. So paano ba yung gawin, ma'am? Paano ko yan gamitin sa aking research? I'm gonna show you my favorite model. So yun yung usually ginagamit ko lagi. The KAP model, Knowledge, Attitude, Practice. Okay, so yes, that's it. So tama ba? 7, 8, 9. Yeah. So sakto lang ako. 2 hours lang daw ang lecture. Okay, so I'm gonna dismiss you now. I hope you learned something from today's class. Did you learn something from today's class? Group call. Okay. So, yung lesson kahapon. Sige, lesson kahapon i-upload. Sure. Gusto mo sa YouTube? Uy, alam niyo ba unfair? Kasi yung teacher lang pala yung nakikita na nagsasalta side by side ng PowerPoint. Hindi ko alam yun. Kaya nung nireview ko yung nasa yung mga estudyante ko, ba't di ka sila nakita? Ganun pala pag Google Meet. Sa Zoom kasi, kita. Sa Zoom, kita yung mga participants nasa side, gano'n. It's so unfair. Okay na. Yan. SKL. Okay, wala na. Okay, so if you don't have any questions, clarifications, wala. Sige, back to sleep na. Ay, wala kayo class, di ba, after ko? Research na ulit. Ayan. So, pwede ulit matulog. Pagpatuloy mo na yan, Elijah, yung pagtulog mo. Si Elijah, alam mo si Elijah, frustrated tong DJ. Every time ko tong mahuling naka-unmute, may sounds.
Ma'am, hindi po ako yung
Char lang, char. Hindi, pero pag sa mga group kasi, yung alam niyo yung sa research, yung consultation, yung pumapasok ako sa group nila, may pa-sounds. Sabi ko frustrated DJ. Sige, yung lesson kahapon tsaka yung lesson ngayon, try ko upload sa, i-attach sa Moodle. Okay, wala na? Okay, that's it. See ya.
Thank you po, ma'am.
Thank you po, ma'am.
Thank you po.
Thank you po, ma'am.
Thank you po, ma'am.
Thank you.
Thank you, ma'am. Thank you po, ma'am. Bye po.
Bye.
Thank you po, ma'am.
Bye, Julie.
Thank you po, ma'am.
Okay, Isaiah, bye.